Originally from Arizona, wife is in LA. She's LA forever, so we ended up moving here. She's a family doc at UCLA. And I do inpatient care in the hospital at Kaiser West LA. I will be talking a little bit about the vaccine and my experience with COVID, and I'm around for any questions or anything you guys need.
Great.
Thank you. We have a small group, so I'll call on people to introduce themselves as I see them in order of my screen. So Kate, you're up.
Hi, I'm Kate. I work in case management and partnerships and resources.
At Homeboy?
Yes, yeah. I'm here for a year, like doing a year of service.
Great.
All right. Emma, then Brett, then Van.
Hi, I'm Emma. I'm currently serving as a Jesuit volunteer in the Educational Services Department, so helping students enroll in our GED and high school diploma classes.
Hey everyone, Brett from the local organizing committee with Fabian, Van, Maria Elena, and others. So basically just putting on civic engagement activities for the people at Homeboy.
Van.
Morning, everybody. So I'm Van. I'm also, excuse me, I'm also with the local organizing committee. I'm sorry I missed the first few minutes, but I'm very excited for this workshop. Thank you.
Cool. Then I have Maru and Maria Elena next.
Morning, I'm Maru Villegas, and I work for the finance department as AR for Homeboy. And I'm here to learn more about the vaccine.
All right, Maria Elena.
I'm a member of LOOK with Van, Brett, and Fabienne and Donna, and I'm just like a longtime all-around Homeboy Industries volunteer. I was your voter registration lady until you didn't need one anymore, and my mother was a Filipina RN, so I am thrilled to see Homeboy become a sort of medical center. She would have loved that.
All right, thank you. Carly and Claudia. Carly, are you there? If you are, you're on mute. If not, Claudia, do you want to go?
Yeah, I'll go. Hi, I'm Claudia. I've been a part of Homeboy my whole teenage life, since before I had babies, and I just wanna I'm pregnant right now. I'm expecting my baby next month, so I think I can't get no vaccine. Maybe like I'm trying to give myself 3 months after that, because I will be breastfeeding, and yeah, I just want to be I just want to really have my baby in my house as well too. Like, just it's pretty scary, but I'm here because I want to learn some things about that. And Jose touched about like your wife had a vaccine different from yours, so I have no clue what you're talking about. So I'm excited to learn.
Well, hopefully by the end of this meeting, you will have more information about the vaccine than you could ever imagine.
Yeah.
All the different kinds and the safety during pregnancy and breastfeeding.
Yes. Thank you.
All right, Donna, then Amy.
Hi everyone, I'm Donna. I'm part of the LOC and also with legal and tattoo removal now. And I'm happy to be here. I'm getting my second shot in a few weeks.
Hey.
Nice. Amy?
Hi guys, I'm Amy. I'm with tattoo removal and development right now. Just excited to continue learning about the vaccine and how our Homeboy lens can be incorporated in it.
All right. Cardi, I see we got you back.
Hi, sorry about that. I'm Carly. I'm in workforce development. I am getting my second shot this afternoon, so I'm excited to learn more and appreciate you taking the time to tell us about it.
Cool, thank you. And then Jessica just joined. Jessica, are you there?
Hi, yes. Sorry, what are we doing? Introducing ourselves?
Yeah.
Hi, I'm Jessica, and I work with Fabian in the government relations team.
All right. Thank you all. So yeah, as was mentioned, I think earlier, this is part of the monthly civic education classes that we have at Homeboy Industries, brought to you by the local organizing committee. So today, every month we have different topics. So today we wanted to focus really on the vaccine. We have Dr. Anaya with us and Dr. P. So who's that? Is that Marcos waving in Carly's camera? I miss Marcos. Get your vaccine, yeah.
He's gonna come back.
Yeah, cool. So today we wanted to focus on that and really kind of go through some of the facts, making sure people understand what it is, what's in it, and then also just answer some questions. I think amongst us, but also amongst a lot of the clients, there's still some concerns. And part of it's just maybe misunderstanding. Part of it's just, it's inaccessible, so don't worry about it right now. So we're hoping today to answer some of the questions and then also be able to provide some information on how we're going to try to make it more accessible to the community in general, but also to the Homeboy community specifically. So with that, Dr. Anaya, if I can hand it over to you and just kind of jump into the flow of it.
Yeah, thank you, Fabian. Again, thank you for having me here today. My name is Dr. Jose Anaya. Originally from Guadalajara, came when I was 4 years old to Arizona, been there all my life. Came to California for residency, and then my wife again, and met her in LA, and we've been here ever since. So I am a hospitalist, which just means I do only adult hospital care. People get sick in the hospital, in the ER, have to be admitted to the hospital, I take care of them. We have been, I think, us in the ICU and the ER, the frontline providers during the pandemic over the last 11 months. Just obviously we know COVID is real. I know there's been so many talk about, even with my own suegros and my tias in Guadalajara, and you get these talks about it's not real and it's all a conspiracy, and so just talking about that disbelief, and that's kind of played into our community, and just our understanding of the virus and how it works and how dangerous it is for us. Just some quick facts that I think most of us know. I looked it up today. So currently in the United States, there is over 26 million people infected with COVID. I can guarantee that's an understatement. I can tell you people that I know who have gotten it, that have not gotten tested. We didn't test the very beginning of the pandemic. People that died, we didn't test before. So I'm sure the number is lower than it really is. Number of deaths so far in this country is 456,000 people have died. That's a lot. That is an obscene number in 11 months. And again, I think it's underreported. People, again, nursing homes that passed away that weren't tested at the beginning. People that I know who just didn't want to come in and get care and got sick and passed away at home. So that's a very high number to have. And it's sad because this could have been, sorry, give me 1 second.
You need to move around.
My light turned off. I got to move around and flail my arms, so I'll do that. No, so talking about COVID and how sad this infection really is. The sad part more is this could have been preventable, and this could have been a lot better controlled and handled. Looking at the current, I think last month's data from California, it's obviously we know, and I can tell you in the hospital, and I'm sure on the news station, is that this infection disproportionately affects people of color a lot more. As of now, if you're Latino, you're 3 times more likely to get COVID and to be hospitalized than if you're white. And if you're Black, you're twice as much chance of getting, again, infected and pass away than if you're white. So we know, it affects our community more. And then why, right? And I think part of my belief in terms of in the hospital and hearing the stories of people coming in getting sick, it's always the same story. It's always, I'm an essential worker. I work, at the airport, or, as a cook or as a valet. I had to work. I got it at work. I brought it home. You know, in my family, my suegros live with me. I have my sister-in-law. So we all live in a multi-generational household. We bring it in. We don't know we have it for a few days. The whole house gets infected. It's the same story over and over again. And it's heartbreaking to hear, you know, in the hospital, my community, growing in my community, just getting devastated by this virus. It's an awful, awful virus that it's sad that after 11 months, we don't have that much to do to treat it. To see people, you know, from, you know, Mexico, from Guatemala, from El Salvador, you know, you hear them, you know, scared and gasping for air, and you can't do anything about it. It is a horror that I wish no one ever experiences. Why it's important for us to talk about that and to bring up these horrible stories is because this is very real, and this can be preventable if we do, you know, very basic things. And one of it is obviously, you know, is wearing masks and avoiding large crowds and only going out if you have to. And obviously, again, is the vaccine. We have seen that we have kind of waited for that for the last few months for us here in the healthcare field. The importance of the vaccine, it's one part of the overall goals to make the pandemic, you know, go away and go back to our normal lives, as normal as they can be. Just some facts about the vaccine. So it's the frustrating part, or I guess the hard part about the vaccine, is that it's a newer technology in terms of how the vaccine was created, which is why there's so much misinformation and anxiety, and rightfully so. Even amongst us as doctors, we were worrying about the vaccine and the efficacy. So just, you know, quick basic on the vaccine. There's still old school vaccines, right? Flu that we had for many, many years. It takes 6 months to make a flu vaccine. It's a, you know, labor intensive process. You create, you know, you make this virus, you give it some flu, you grow it in eggs of hens, you let it grow out for months, you harvest the vaccine, you kill the vaccine, and you harvest the proteins, and you actually get the proteins in as a vaccine, right? And so when you as you're a recipient of the vaccine, you get these protein, your body kind of gets like a heads up, hey, this protein is a virus. You learn to make, you know, immune cells and antibodies to fight the virus. So if you get the real virus a few months later, you already have some immune system to the virus, so you won't get as sick. You know, for the flu vaccine, people always think, oh, well, I get the vaccine, I get sick every year. Yeah, and that's possible, but the main goal is so you don't die of flu, because you have protection already. So that's the old school vaccine. There's a couple vaccines now in the market that are coming through. The AstraZeneca one, the one Johnson & Johnson, the one in Russia and China, those are all that similar technology. The newer ones with the mRNA that you guys heard about, messenger RNA, which is what we have in the country now, which is the Pfizer vaccine and the Moderna one, which is the one that I received, the Moderna one a few weeks ago. So that one, it's new technology. It's been around for 10 years. It's the first time it's been introduced into actual vaccine. And it's a really cool way of creating vaccines. So what happens is, so messenger RNA is a small piece of code, basically, that can make protein. Now, they create this mRNA, they give it to you as a vaccine. Your body recognizes it and makes the protein for one of the proteins of the coronavirus. That helps your body recognize that protein and make antibodies towards that protein. It does not give you the virus. It only replicates and basically makes more and more protein, so your body gets that immune response. So when you need it, when you do get COVID, you won't be as sick and you won't hopefully die of COVID. Now, the vaccine and the messenger RNA does not become a part of your DNA. It does not go into the nucleus of a cell to transform your DNA into any other animal or anything like that. And it goes away in a couple of days. The mRNA with the vaccine is not there permanently. It's just there designed to make proteins to give your body an immune response. So when you get actual COVID, you don't get very sick. So that's kind of the basic science of these vaccines. Now, is it safe? That's we think so. This is, again, it's a new technology. It's new in terms of vaccine production, but it's been around for about 10 years. Because it happened so fast, even I was skeptical of the efficacy and the safety. We have now, here at Kaiser, most of our doctors, 90% have already been vaccinated. We have most of our staff been vaccinated since December. Very few, there's been no deaths. There's been, you expect to get some, flu-like symptoms the day after the second dose of vaccine. That's pretty normal. I was, the day after my second shot, I was, in bed, I was tired, I was having myalgias, and I was weak. So that does definitely happen. Dr. Pearl will probably tell you as well. Dr. P, she also was out yesterday. But the day after that, you're back to normal. There is some, it's not really a side effect. It's just, it's what's supposed to happen. It's the body's immune response to the vaccine is working, and you're mounting protection for in case you get the real virus down the road. So you expect to get some, swelling or some arm pain at the site of the vaccine for a day or so. And then you might have, few of my colleagues have gotten some nausea, some low-grade fever, some chills, some abdominal pain, some muscle ache, basically like the flu. You feel like that for about 36 hours and then it goes away. After the second dose, it is a little stronger immune response. So you might have more symptoms of flu-like illnesses after the second dose. What else can I tell you? So that's kind of the basics of the flu vaccines. I'll stop for a minute and answer any questions about the vaccine itself, how it works, side effects, concerns, before we move on.
Jose, I'm wondering if you can address the concern that a lot of our clients have that they've already had COVID. So do they need to get a vaccination?
Yeah, that's a great question. So what we know so far, the data is that we think that if you have COVID and you recovered, one, that's a blessing, and thank goodness you guys are still able to, still live a functional life after COVID. We have people get sick for months and months at a time. We think you have about 90 days of immunity if you got COVID the first time around. So we say if you had COVID after 90 days, you can get the vaccine, and you should get the vaccine. We don't know if this is going to be a lifelong immunity. We don't think so. We think it's going to be, you get immunity for a few months and then you can get it again. With the variants that are now coming out from the UK and Brazil and all these places, you worry about, you might have had COVID, you might have had 2020 COVID, right? 2021 COVID might be different, and you're not immune to that one. And so far with the data is that the vaccines, the Moderna and the Pfizer, should be protective towards the new variants as well. So yeah, so definitely if you had COVID, still consider getting the vaccine about 90 days after you had recovered from COVID.
Dr. Anaya.
Yes.
So these are, I'm sorry. So these RNAs, when they get into our system, how do they know, or when do they stop performing or leave?
Yeah, that's a good question. We think it's about 5 days.
Okay.
It's just a strip of code. It's just, a couple of letters of DNA, or it's mRNA. So it's not even DNA. It's just half of the DNA. And it just basically makes your body read the code and make proteins to make your body think that you have COVID. So it makes antibodies to protect you from the actual infection. But it's about 5 days, the mRNA dies out. But it does its job. It just makes you get a bunch of proteins to develop that immune response.
So just that dosage, that batch, those messengers are the ones that are telling our body to replicate the proteins, right?
Exactly.
It's just out of curiosity, like those specific ones do their job and then they die or they multiply.
Yeah. So messenger RNA is very unstable. It's only half of the DNA helix. So it's even your own body's mRNA does not last very long.
And the most important thing that I think people are concerned about is that it does not enter into the nucleus of the cell where all your DNA is, all the genes are in every cell. The mRNA doesn't get close to that. So it just uses the machinery of the cell to make this protein. It's really an unbelievably elegant system. And like Dr. Anaya said, this has been ongoing for many, many years, and they already started to develop vaccines using mRNA, I think for RSV, respiratory syncytial virus. The timing of this was perfect because to make a vaccine, you need to first get a lot of volunteers to take it, but then you also need a lot of disease, because what they do is they give you the vaccine in the studies and then they wait until people get sick. Well, they didn't have to wait very long for these trials. And what they find is that people who got sick were the people who did not get the vaccine. There were 5% or some percent of people who did get sick who got the vaccine. But of critical importance is that none of those people needed hospitalization and none of those people died.
To add to that point, I think I'm glad you mentioned Dr. P. There's always a question of, will I get COVID with the vaccine or not? And the studies weren't designed to know if you got COVID or not. Designed to know, were you symptomatic from COVID? So we don't know for sure how many people who get the vaccine. You might still get COVID, but you have no symptoms of it to know. So you can definitely still, it's why it's important that the vaccine is, again, one part of the, plan to eliminate the pandemic. It will help you, 95% chance of preventing serious disease from COVID, but you might still get COVID, you just won't know about it. So the importance of wearing a mask, even after getting the vaccine, is very, very important. The vaccine should not change our habits. It should still be the same, minimizing, gathering, social distancing, wearing a mask. But now at least you can feel comfortable that if you were to get COVID, it will not be severe enough to come into the hospital. And we think that if you're that sick and you're more contagious, you're shedding more virus, you're coughing on your family members, we think that it will lower your transmission risk as well. But we don't know the question to, will it prevent COVID infection? We don't know yet. We know that it will minimize the risk by 95% to get severe symptoms of COVID.
So it's important to still assume that we're still able to get the virus and pass it on to others, right?
Absolutely.
Yes.
Yeah. Thank you.
For now
right.
it is.
Yeah.
I think I just, like I said, I read some stuff this morning about that, and all of this is it's mind-bogglingly fast the way all the information comes out. I mean, I'm so impressed. It's likely that if you've gotten the COVID vaccine that you will not be infectious. That's likely, but we just don't know. And that's why we ask people to wear masks and maintain their social distancing, hand washing, and all the other good stuff we've been doing.
Can I ask, how does that connect to herd immunity, and what's the importance of getting there and getting everybody vaccinated?
Yeah. So we talk about, when do we think that, we can go back to normal life? I have no idea when, and I don't know what normal will look like, a few years from now. Herd immunity is when we think 70% of the population has been exposed to COVID or have antibodies to COVID. That's kind of our target goal from Dr. Fauci, is that 70% of the country would have antibodies to COVID. And so it would be less likely to get severe COVID if 80% of the country is having that herd immunity. So that's a lot. We're barely at, I think, 10% of the country at least infected that we know of. You vaccinate, 1 million people a day, it'll take us several months, end of the year to get that herd immunity, assuming everyone takes the vaccine, right?
And in addition to the herd immunity, I mean, until we get to herd immunity, a lot of people are going to die.
Yeah.
Because a lot of people will get sick. Dr. Anaya, there's a question about which vaccine is the best. Are there any differences in the vaccine for patients of different races and ethnicities?
That's a great question. The best one is whichever one you can get. That's to be perfectly honest with you, we're a very wealthy country and we're very blessed that we have these 2 vaccines now. I have all my family, my abuelos and my tias in Guadalajara, they're going to get the Russia vaccine. And there's more, question about that vaccine versus the Pfizer and the Moderna one. So far, the Moderna and the Pfizer, again, it's at 95% efficacy or safety that you will not get severe COVID from it. The AstraZeneca and other ones are like in the mid 70% range. The flu is like 40%. So compare that 40-50% of flu vaccine. Now we're talking about 95%. It's impressive. We don't know, there's no studies to show which one is better for what population. I can tell you again, we have the Pfizer and the Moderna one now here. So does LA County Public Health. Whichever one you can get. Some protection is better than no protection. Especially now, because you don't know, everyone can be having it. You don't know, I have people in the hospital who got it at the store, who only went out, once or twice to the store wearing a mask, and they still got COVID. So I would say any vaccine you can get your hands on, as soon as you can get a vaccine, it'll help us get us to more normalcy, in the future.
I have a question on
Yeah.
that. Okay, given that what we know right now is that if you get vaccinated, it probably is good for 3 months, as far as we know, if I understood that correctly. And given the very slow rollout in the different tiers of people getting vaccinated, where even Dr. Fauci admits that we may not have the whole population or enough of the population covered until almost the end of the year or into fall of this year, because there is inadequate supply of the vaccine. Does it look like then everyone who got vaccinated in like December is going to have to get revaccinated every 3 or 6 months if the immunity wears off? Is that what we're looking at? I mean, I'm somebody who took allergy shots for 16 years at Kaiser.
Right.
That was a life. But is that what we're looking at, just to attain herd immunity?
Yeah, that's a great question. We don't know. Personally, I think it's going to probably be a seasonal vaccine like the flu is. But it's still early to know how much the vaccine protection lasts. We don't know. 3 months is from, actual COVID infection that we know of. They're doing studies now at all these medical centers, checking people for, IgG or immune levels after COVID, months out. We just don't. It's too early to know.
Okay.
But it might be a yearly vaccine.
With constant testing, just regular testing during the year?
I don't know. Probably. It's frustrating to think of, needing a yearly vaccine or a yearly booster. Hopefully the booster would be only 1 shot and not 2 shots. I mean, it's just so early to predict. And the variants are coming out. All these countries are getting the virus is mutating. How that's going to play a role in the next dose. I mean, it's just, there's too many ifs. The main, point for today is, and to, pass on to your family, especially our communities that are being so affected, is, do the basic things, wash your hands, wearing a mask, social distancing, and get a vaccine as soon as you can. This, I can tell you, this is nothing I've ever seen in my entire career as a doctor for over 10 years. This virus, it gives me chills thinking about there is nothing really that good that we have to treat. People come in and it's the same story, and you know who's not going to make it. And it's just so frustrating and angering to think that you can really do nothing for these patients. Had they, done X, Y, and Z before and not gotten it or gotten less of a viral load, they might have survived. And it's just, it's devastating, especially because it's mostly our community. I can tell you here, 80% of my patients here that have COVID, more than half of them are Spanish speaking only, underinsured, uninsured, all essential workers, or got it from, their mother. And we had so many families, mom, dad get it, mom, dad dies, mom's daughter dies. I mean, it's any age, 25-year-old, 80-year-old. It's just, it doesn't care. What I have seen a lot of all the people that have gotten really sick here, 90% of them are, again, they're mostly Latino and Black. They're obese and they have diabetes. Even the young ones, obesity has been the #1 predictive, risk factor for someone young dying, and we don't know why. Is that tied to, obesity in our communities from, lack of good, healthy, food in our community that leads, is it tied to socioeconomic background? But being of color is danger. It's horrific, just horrific.
The good news is that the vaccine in all of these trials, Moderna, Pfizer, AstraZeneca, and Johnson & Johnson, they have included in their population who they're testing people who are obese, have underlying comorbidities like heart disease, diabetes, et cetera, et cetera. And again, the results are that none of these people who have a lot of risk factors require hospitalization, and none of them die. So it's really a hugely beneficial key tool that we have.
I can tell you from experience here, a couple of my colleagues who got the vaccine, their kids got COVID from, their school pod or their whatever they're going to, and the parents would take care of the kid, and they never got COVID. They were tested multiple times going to work, and with the vaccine and someone directly, you're taking care of a 8, 9-year-old, you can't quarantine from them, and they were COVID free, 2-3 weeks later. So it's, to me, that again, it's a very small sample size, but that's helpful to know that it probably can prevent infectivity as well.
For either of you, I have a few points. So the first one is we have the technology that we have in producing the vaccines here in America. They have different names, but so that's basically what it is, right? Just different companies producing the vaccines, right?
Yeah, it's a private technology, that Pfizer and Moderna have their own. Every company, again, it's when there's money involved to be made. That's why you have so many vaccines being produced. There's so much potential benefit from these companies because the whole world needs it. So the demand is extremely high. So that's why I think it happens so fast. I've never seen a vaccine developed to production to distribution this quickly in the history of the world, because the demand is so high.
Well, from what we know, it's pretty much the same, right?
I mean, the technology-wise, for the Pfizer and Moderna, the same. And again, the other ones have the old school, model of not using mRNA.
That's not Johnson, right?
Johnson, I think that's the adenovirus, that kind of the older way of making vaccines.
I want to share this also. I know a lot of people, and I want you to address this myth, right? Because a lot of people, they're really scared about going to clinics, hospitals, because they think that that's where they can get the virus. And so even for the people that I know who have gotten infected, they kind of hesitated or refused to go to the hospital until the very end, right? And so they didn't make it. They passed away because of that, I believe. But also to another point, a lot of people that I know believe that kids somehow are immune to it. Like they think that kids don't have to worry about it. So can either of you address those 2 points, please?
Yeah, I mean, kids are definitely getting infected. It's luckily that they're not getting as sick as adults. And I don't see kids, so I can't talk to how many kids in the hospital. So I can't really speak to that. We know that mentioned in New York in the past, there's these kids that got, in the summer that got very sick and died. I mean, my ER colleague will tell me that there is kids coming in with COVID. They all get shipped to CHLA or Kaiser Sunset, who has pediatrics. We don't have pediatrics here, but I know the kids are still getting infected.
Yeah, there's no question that kids can get infected with the COVID vaccine, the COVID virus. They don't, as Dr. Anaya said, they don't get as sick unless they do. I mean, there are some kids who have gotten very sick with multi-system breakdowns, really catastrophic and long-term effects. A very small portion, minuscule portion, but it can still happen. So kids don't get as sick, but they, just like they always do, can transfer germs very easily bring them into the house.
Right.
Do we know if they're not getting infected or that they're not showing symptoms?
No, they get infected. They can be infected. They can have the virus, but they don't get sick.
That's the worry, I think, of schools reopening without teachers being vaccinated. Is the worry is the kids will get sick, they won't get as sick, so they'll keep going to school. The teachers get it, and they end up dying of it. That's the biggest, scariest part of opening schools again without the teachers being vaccinated.
So they're not different as a class, right? Like that's what I'm hearing. Like, oh, kids, you know, they don't really get sick from it, or they don't get it.
Yeah,
they
don't get as sick. Thank goodness. Could you imagine? I can't imagine this level of, you know, illness in children. But they do get very sick. They can get sick, just not as the numbers as adults.
They're not special in the way that they're immune to it, right? As kids, like they can still get infected and not show symptoms and pass it on to adults, right?
Yeah, of course. Yes, they can.
Also, I'd like either of you, you know, since you're in the hospitals, I know people who actually say that they don't want to go to the hospital. I've had at least three cases where their families really believe that they regretted taking their loved ones to the hospital because they said that the symptoms were mild, that they were fine, and they took them to the hospital, and the hospital quarantined them and wouldn't release them, and you know, they died like within 3 days in there. So if either of you can highlight like what's going on behind those doors.
Yeah, so it's a very common misconception of what hospitals do when the fear of coming here and dying here. I've seen, right, so 11 months now that usually, say you get infected, you know, on day one, at about 10 to 14 days, you start getting the inflammatory response. That's where your body is this huge response to the virus, where you start getting scarring of your lungs. They start getting sick at around that time, you know, 10 to 14 days, the worst part of it. They can't breathe. They get very short of breath. They're having fevers. They lose their sense of smell. People that wait too long, when they come into the hospital, they're, you know, 2-3 weeks into the illness. They're so sick, and their lungs are so scarred. There's nothing we can do. And it's interesting because this virus, for whatever reason, someone looks wonderful. They're talking to me. They look non-toxic, but yet their oxygen levels are 50%, which normally that means you would die. But because most of them are so young, they have such reserve that they can tolerate such levels of lack of oxygen that when they come here, they're so sick. They come in the hospital, they get intubated, and they pass away because I think they waited too long to start initial treatment to lower that immune response. So that is the fear that once they come in, they don't come in forever. They finally come in and they die. Yeah, I think because you just came in too late. There are treatments that we do earlier on. You can do, again, there's plasma that we can do within 7 days of symptom onset. We do steroids, we do remdesivir, treatments that we know can lower the immune response. So that misconception is real. I understand why you think you come in and you die, or you come into you get intubated, and everyone who dies because of the intubation. It's just misconceptions of the virus and how it works. We've seen the pattern again. It's consistent. You know, 10 to 14 days is probably when you get the sickest. But then we see people in the hospital for a month at a time, and they get better and they get sick again. We have no idea why this happens. There's still so much unknown of this virus and so much fear that our treatments are still very inadequate. And I pray and hope that we'll be better treatments eventually. Because once you have good treatment, it's not a very hard virus to fix. But we have no good treatments yet. So coming in earlier is important.
The question on that, if someone were to come, you know, to the ER, or basically people don't come until they have severe symptoms. So even if you saw someone that was not that badly off, did not look, would they be admitted to the hospital?
Yeah, no. So if they weren't that sick and they had, you know, no evidence of kidney or liver damage and they had no need for oxygen, they would not. But I can tell you, at least at Kaiser, we have a home monitoring program that you go home with, where a physician is, you know, texting everyone every day. You have a little oxygen machine to look if you need oxygen or not. If you were to get sicker, we call you back. But some people get COVID and they don't get sick at all. They have a couple days where they feel under the weather and they go back to work and they feel fine. So unless you need oxygen or you have evidence of organ damage, you don't need to come into the hospital for COVID.
Okay.
There's a question about breastfeeding and pregnancy.
Yeah.
And I want to just read something that I got from the University of California at San Francisco. And basically the answer is that the vaccine is safe for both pregnancy and breastfeeding. Remember, Dr. Anaya talked about how the vaccine is really kind of fragile. It's weak. It gets injected into your arm. It's mostly taken in by your arm, by the cells around your arm. It gets taken up and then it's gone. So it will not, the vaccine itself will not be transmitted to the fetus, to your child, whether it's in your uterus or through breast milk. But the antibodies that you develop against the virus may be transmitted, and that's a good thing. That gives your kid, that gives your baby immunity.
Thank you. I also had what about I wanted to know I like how he used the word skeptical, but what do you suggest, doctor, for you know, for like next month when I do give birth? I know you're not an OBGYN, but I would like more of a what is it, more of an advice from a real doctor than a OBGYN. Well, is he?
I love that I'm a real doctor. I just got a promotion. Tell me again what the question is.
Like, what do you suggest? Like, should I just wait until like, I would rather prefer like wait until my water will break, right? Like, so I could just go and just, you know, not get induced or like, just not have to wait like the procedure to just like put me in bed, and you know, I just want to go and just give birth to my baby girl, you know, and just eat or just stay home and just have the baby on the bathtub. So but I don't think that would be too healthy now, you know.
You know, it's a very personal, that is a very personal decision where you're going to deliver. I think that what I want to reassure you is that the vaccine is safe for you, both you and the baby. And as somebody who is pregnant, you're actually in a pretty high risk category. You know what I mean? That, you know, that increases your risk not of getting COVID.
Blood thinner on the 6th. And I want her to get a total of 10 days.
But I think
so I'm gonna have
guys
her
talking to somebody else. I forgot what I was saying. So
something about
sorry.
10 days.
Happens.
You said she's in a high risk category.
You're in a high risk category, not for getting the virus, but for getting really sick with the virus. So, I mean, my recommendation would be that to get the vaccine as soon as
I'm assuming that everyone's going to have to coordinate with transportation.
Jose, put yourself on mute.
Sorry, I'm ready now. I can talk. Yeah, just to answer your question, as Dr. Perlman said, you're right. You are a higher risk because you're immunocompromised because of your pregnancy. I have colleagues who have gotten the vaccine, you know, first, second, third trimester. I think there's data that your baby might benefit from the vaccine because you can pass on the antibodies to your baby. So I think if you're able to get the vaccine before you deliver the baby, I think it'd be a very good idea, even if just the first dose. We think that even the first dose gives you some protection. And again, because the mRNA that's in with the vaccine goes away in a few days, we don't believe there's any damage to the baby or to yourself. It just gives you protection during the pregnancy and afterwards.
Thank you. I appreciate it.
Thank you both.
That's
yeah, good luck.
Thank you.
I just lost my train of thought. So I do want to talk about the actual vaccine shots, right? Some of us here have already gotten it, and I would like to be able to share for those who haven't gotten it, because before I got it, I was really like, to be honest, I didn't think about it or want to get it actually, you know, but only through work and then living with my parents, I took it. And for me, I took the second shot yesterday, and I was anticipating feeling, you know, sick. But I really didn't feel anything. It's just my shoulders kind of sore and stiff, and I felt maybe 4 to 6 hours after the second shot, I felt just really tired, but that was about it. And then today I feel fine. Um, but yeah, I wanted to ask, like, how do we know that it's working? I know that feeling the symptoms is a good sign, which I've been telling people, like, that's something to expect, and we really want that, right? To know that our body's accepting it and responding to it. But maybe you guys have a better way of gauging it.
Yeah, so I think I'm glad you're lucky that you had no real good symptoms. That's a good thing. Again, this virus, we don't know why people feel nothing and get COVID, why people will get it and die. I have no idea. I've read nothing really to tell me, to explain well enough to me if we understand why this virus is different in everybody. In terms of the side effects or the reaction to the vaccine, again, we want that immune response. So you're gonna have, you know, it's kind of, if you could get COVID, this is what COVID would have felt like for you, right? Some people get nausea, vomiting, loss of smell. Some people just get, you know, abdominal pain. Some people get cough, fever, chills. For me, again, I got the Moderna vaccine, both dosages, I think a few weeks ago now. And yeah, the day after the vaccine, I was, you know, tired, hard to get out of bed, you know, muscle aches everywhere. But the day afterwards, it went away. My wife got the Pfizer vaccine, and her, you know, second day after the second dose was also had some chills, low grade fever, feeling not well. But then again, the next day you're magically back to normal. So it does vary from person to person. We don't know who is going to have what reaction. People who have my wife also did allergy shots the last, you know, 10 years. So she worried about her, you know, reactivity to the vaccine. But they watch you, you know, after the vaccine for 30, 40 minutes. If you're high risk, make sure there's no reaction to the actual injection site. But expect some symptoms. That's a good thing. It means the vaccine is working. Whether to know if it worked or not, unless you're checking, you know, IgG antibody levels after the vaccine, which no one really is doing, we don't know how much immunity you have compared to someone else. But side effects, symptoms are a good thing.
Thank you so much. Great information, by the way.
Go for it, Emma.
Sure. So I received my first dose of the vaccine a few weeks ago, and I'm actually going for my second dose today, like right after this. So I'm now feeling very excited about that. I can definitely say, so my undergraduate degree is in biochemistry, cell and molecular biology. So I spent quite a bit of time studying viruses, vaccines, but despite all of that, I was still kind of nervous to get the first dose just because it came out so quickly. mRNA technology is still relatively new. So I wasn't really sure. I was pretty sure I was going to get it, but I was still kind of nervous about what the side effects would be, if it would be effective, lots of questions. But once I did some research from sites like the CDC, the NIH, Johns Hopkins, Mayo Clinic, I did a ton of my own research. And once I read more about studies and realized that the vaccine is safe and effective, I felt like I kind of had a moral responsibility to get vaccinated, not just to protect myself, but to protect the people around me, you know, the people I interact with at the grocery store, but also the clients who I interact with at Homeboy. So as soon as I found out I was eligible to get the vaccine, I signed up and was able to get an appointment within the same week. I know that it's not, sometimes people have hard times like getting appointments right now. It's not quite as accessible at the moment, but you know, I would say for me, I was constantly checking to make sure that I was able to get an appointment because I just felt like it was really, really important that I did. So my roommate Carly and I, who's on the call, we got our vaccines at Dodger Stadium. Everyone was super welcoming, very kind, and just very excited to see us there. So it was definitely nice to have that reassurance from nurses and doctors. And the shot was super easy. We sat in line, waited for probably 45 minutes to an hour. It was a normal shot, like getting a flu vaccine. And then I had no side effects during that observation period. And then even the following day, I was a little bit sore, but really not much of an effect. So, I obviously talk to your doctor, do your own research, but I felt like it was important for me to get the vaccine. So I would say, if you're able to, I would recommend it.
I think to add to that point, I think the biggest thing that we can all do, the ones of us that understand the science, understand the safety and the reason to do it, is tell our community, right? Tell our papas, or abuelos, our tios, or tias, our cousins. There's so much misinformation out there. My in-laws, they get their WhatsApp messages from their comadres in Guanajuato and Mexico, and there's so much stuff that's going on that they're getting bombarded with, where there's a chip and they're trying to identify you, and it's not, they're going to give you an extra ear. I mean, just things that are just so outrageous. And it's so counterproductive to our community. I mean, I wear a button every day in the hospital saying I was vaccinated, ask me about it, especially to our healthcare workers, my EVS staff, they're mostly all Latino and Black. And there's just so much distrust because it's affecting our community so much more. I think our voice has more of a weight in our community because they need to know that the dangers are real and this is very preventable. And it's affecting our community so much more. And so the more we can do to, address those concerns and hopefully convince them that this is very safe. I mean, if it was not safe, the doctors would not have gotten it, right? Because without us or nurses, there's no way to take care of anybody. We've all gotten it. There's been no side effects, significant side effects. There's been no death. There's been nothing out of the typical, vaccine stuff that happens when you get a vaccine, like the flu. So whatever we can do to, increase our voice in our community, I encourage you all to do that. Once you have the vaccine, let them know that you got it and you feel fine and you feel better. We just need to do a better job of outreach in our communities, because it's really, I can tell you my COVID wards that I go in every day and see, it's 80% people of color. And it's most people that are older that got it because their son or daughter or whatever reason got it and they got it. It's just, it's horrific and devastating to see your community this badly disproportionately affected. And, we should get the vaccine soon first, right? If we're essential workers, if we are, the ones doing all the cooking and, transporting food and doing all the things to keep the, the economy and, in our community afloat, we should be the ones that getting it first on. So please, if there's a chance to get it, don't hesitate. Tell your family, tell your, your cousin, your friends, anyone who's going to listen. They have to get it to keep them safe.
Emma, it's interesting. My story with the vaccine is very much similar to yours. I was hesitant because I thought, how could this happen? They've been working on an AIDS vaccine for 40 years. But it's because the mRNA technology was just teed up. Everything fell into place at a perfect time. So I did my homework too. But now, like Dr. Anaya said, it's up to you and I to spread this into the community, to dispel the myths. I'd like to talk a little bit about what are the myths. There's some concern that Bill Gates wants to have us all chipped. I would suggest that if you have one of these, you're already chipped because everything is being, tracked. What else? What else where does the pushback come from? What are the concerns?
Dr. Now, you spoke about the medical community, having more knowledge, and also you too, Dr. Paula. But just on the training that they had for the county the other day, and I heard one of the gentlemen, I think he was in nursing or something, but I don't know what kind of facts he had in making his statement, but he put it out there to everybody that all of the medical personnel and friends that he has or researched are skeptical about it and have refused the shot. So I don't believe it. I know a lot of family members who are in the medical field and they've all gotten it. So, you know, maybe either of you have better insight on that.
I feel, I don't know, Dr. Anaya, you said that like 90% of the medical staff has been vaccinated. Is that
Yeah,
right?
so the doctors have. It's a lot less than our staff. You know, the cafeteria workers, the janitors, the transporters, it's about 60%. And that's, you know, I've been trying to go to every department. And again, it's all the same concerns that you guys have. I'm hearing here in the hospital of people who are actually helping us here on the front lines. And it's more frustrating because they're exposed to the virus every day. And yet that scares them less than the vaccine.
What is it that scares them about the vaccine, though? What is it that creates this hesitancy? What is the fear?
Yeah, I mean, it's the same thing. It was too fast. It was under a different administration that they didn't trust. It's all the same things that, you know, concerns that I had myself as well. And some of them, you just, again, conspiracy theories, you cannot, you know, make them not believe. They believe what they believe. And my job is just to tell them every time, hey, how's the vaccine going? How can I answer any questions? You know, not being condescending, of course, and being respectful. Those fears are real. You know, I'm not going to dismiss your fears. They're very real to you. So just, you know, talking with more facts, and hopefully eventually they'll come around the corner. Look, my friend got it and she's been fine. She's not been sick. Maybe it's safe and I'll take it as well. But it's the same fears you get here. The same concerns that you guys have, I'm hearing as well in the hospital.
Well, it feels like, you know, there was a lot of skepticism at the beginning from many of the people in the homeboy community about wearing a mask even. But as the experience with this disease as we have more experience, I think people are realizing that, you know, conforming to the recommendations can actually be very helpful. And, you know, maybe we'll see some of that, the reticence to wear a mask has eroded. Maybe the reticence to get a vaccine will erode too as we get more experience with it.
I think what it is.
I think also, sorry, go ahead.
I think what it is because the 90% or so who've gotten the vaccines aren't as vocal as the 10% who aren't getting it, right? Or whatever the percentage. I think the people who are not taking it, they're being more vocal about it. And to answer your question, Dr. P, that I know one of my relatives, he's a very responsible guy as a fireman, and so his reason was that they explained to him, and he said that the majority of the guys at his station refused the shot. And so it really shows that it's a culture, right? It's not based on logic or facts. It's that herd influence. So it turns the responsibility back on us at Homeboy and also in the bigger community that we have to set the example. Too much, you know, technical terms and all of that may be ineffective. But yeah, like Emma said, like go do your research. But I think we're more effective by just doing it and showing the next person, and to be vocal, because the other side is great at what they're doing and they're really putting it out there. But yeah, so the fireman, he said that they explained to him and to them the risks. He said the risk of adverse side effects, he said, was bigger than was higher than actually getting the COVID virus. So that's why he refused it, you know. But yeah, that's what's going around. It's crazy.
And I think those disbeliefs are, you know, are in fear. And if they spend one day with me in the hospital, they'll change their mind. And it's, I mean, there's so many articles. The LA Times article New York Times had an article recently about MLK. I don't know if you guys read it or not, or able to read it. I think it was a couple of days ago, about the discrepancies and just in the care of MLK versus a UCLA or a Cedars-Sinai. How many people are dying at MLK? I mean, there's a video, I think, New York Times as well, like a day in the hospital of a COVID hospital in New York. I mean, it's horror and devastation, and people are dying alone because people family can't buy and see them, and to see people grasping for air, it's a horrible thing to witness. And I think if you were to see that or knew someone who passed away from COVID and realized that is the worst possible outcome, the vaccine is such a small, there's no way to make that argument if you actually knew someone or experienced someone dying of COVID. This is a coronavirus. This is a cold virus. This is the virus we've had for, it mutated and created this new variant, but it is literally a common cold virus for that family. How does that virus devastate so many people worldwide? So again, I think it's, as Dr. Perlman said earlier today, I think people now in the last few months we've seen the numbers surge in the last few months. People now know someone directly. And so maybe now they're changing their mind on the vaccine and the safetiness and even just wearing masks, how important that is now. I think it's tough when you don't have a uniform agreement and plan from the government. I think that makes it also created a time where you can have misinformation and people just not believing what they want to believe. But it's just it's all based in lies and in fear. And I think that's as humans, right? We resonate towards fear. We're scared of what we don't know.
Isaac, you had your hand up earlier. You have a question?
Well, yes, I had a comment that's like, concerning the vaccine is like every day we're bombarded with information, and a lot of times it's misinformation, and at times we get the correct information. And being in my community, it's like, how can we distinguish which is the right information and the wrong? And like what Dr. Anaya mentioned earlier, it creates a lot of fear. And that's where people are hesitant. And even, you start getting all this information about conspiracies and all these conspiracy theories. Then you start hearing that in the future, they're going to make it law for people to get vaccinated. And once again, that's even more fear. Like, that's just stuff that I would hear on this. And like I said, it's just a lot of misinformation, a lot of just being bombarded. Like I said, like every day we put on the news, we're seeing all these deaths, and it's a reality. Whether it's man-made or it came naturally, it's here and we have to deal with it. But like I said, going back to all that information, it just creates a lot of fear, and that's where we become confused. And it's like, like just being here where I'm at, it's like having access to the vaccine, like that. So I think that's what makes people hesitant, being confused and in fear. I don't know.
Well, that's what this forum is for. I'm so happy that you're here, Isaac, because you can hear what we know from the medical literature rather than from the internet, just from, where things get spread around.
And thank you, I appreciate it. And again, too, it's like not everybody has access to this information. Like a lot of people, and that's the thing, like I got it through Homeboy Industries. I'm so grateful for them, but not everybody has Homeboy Industries.
Right.
Yeah.
Well, I have to say, if I were queen, the world would be a great place, but I would start a massive public service campaign, and I would get out, Beyonce and Jay-Z with "I Got Mine," or LeBron James, "I Got Mine," or, figures in the world who are respected and trusted by everybody, to get out and spread the word about the safety. Because, the idea, I don't understand conspiracy theories, Isaac. I don't get it. I don't understand where it comes from, why people believe it, but they do. So, and it's a hard job to convince somebody who knows that Bill Gates is going to put a chip in this damn stuff. How do you convince them that otherwise? I don't know, other than developing trust slowly over time until a person will actually trust what you have to say.
Yeah, I agree. I think it's a matter of time and knowing also how to talk to people. They're just understanding their fear and addressing it first and foremost. I think we can, as we continue to have these kind of workshops and disseminate what we hear here to our community, I think it'll make a big difference. I have to go back to work. I have to log off. Thank you again so much for having me here. I'm available. You guys have my information. Again, the more outreach that I can do to share what I'm seeing, even if it convinces one person to get a vaccine or one person to wear a mask, I think it make a difference. So please, anything you guys need at any moment in time, please contact me. I'd love to come back at any time.
Thank you so much.
Thank you all for having me.
You.
Thank you.
There was a question about the availability and the rollout and the phasing of the vaccines. I have to say, I don't know enough about it. I know that it is going to get easier to get the vaccine, that we are going to have more supplies. Homeboy is going to be a vaccination center. Great. And I just don't know. I don't know enough to address the vaccine, getting it and the supply chain. I don't know enough.
Yeah, so right now the county is in phase 1 and phase 1, so phase 1A, and they've opened up phase 1B. Phase 1B for the tier 1 folks, which is 65 and older. That's going to be going on for a couple weeks, and then they're going to open it up to the phase 1B tier 2, which is the education, food service, and then the emergency service staff. So as was mentioned earlier, so one, we don't know for sure how long each one of those phases is going to last. It's kind of dependent on how much vaccine there is and how quickly they're able to get it out. So I was on the call with folks from the city on yesterday, and they were saying that there may be a shortage, and if we see that, then we may be some sites slow down next week. But again, that's kind of all up in the air, unfortunately, right? That's really beyond a lot of people's control or understanding of how much there actually is. We're hoping that once the Johnson & Johnson comes out, that's a single dose or a single shot, not as effective as the Pfizer or as the Moderna, but much easier because one shot. So it sounds like the city may use that for specific populations, specifically like the homeless population. Does that sound unfair? Why does the homeless get the one that's less effective? Maybe their justification is it's hard to track individuals for them to come back at the 28-day mark for the Moderna and the 21-day mark for the Pfizer. So the better chances of getting them at the highest protection rate is using the Johnson & Johnson. So if that happens, there's going to be a whole big supply and a whole other set of individuals who can get vaccinated at a faster rate. So a lot of it is up in the air again, but as was said earlier, Homeboy is going to try to become a vaccination site. Our goal, really our soft goal, is February 24th to make Homeboy a community vaccination site. And the idea would be that we have 2 different pods, so a drive-through pod and a walk-up pod. So pods are a team that's needed for a vaccination, right? So again, the drive-through is to try to make it as efficient and speedy as possible. We're still working on closing some of the streets and figuring out the traffic flow and getting some of the Homeboy staff to do the security, crowd control, kind of street management. And then the walk-up pod, that's super important because that's a lot of the population that isn't getting vaccinated right now. Those who don't have the walk-up option necessarily available to them. So because Homeboy is easy to get to, public transportation, we felt it's important to have that walk-up pod. So we're gonna do our best to have those open right away. We're looking at actually releasing a needs assessment today to the Homeboy population, but also to some of our partner organizations throughout the city. And that'll help guide us and determine how often do we need to do it, right? So earlier I said 2 pods, each pod can do around 150 people per day. So we would be doing 300 per day, and we may do just once a week. So maybe every Wednesday or maybe every Saturday. The needs assessment asks about preference, whether weekend or weekday, or we may do both every Wednesday and every Saturday, again, depending on the eagerness of people to say, yes, I would take it if available to me. And yes, I want it. And the number of responses. So it's kind of unknown right now. Again, this is new to Homeboy, but when we open or leading up to the opening, and we have that information for the needs assessment, we'll also be doing very targeted outreach. And I think that's what makes these type of vaccination centers different. It's not going to go through the regular county or city portal, which is another huge hurdle, right? One is just the hesitancy, which is real and it's out there, but there's more than enough people who want the vaccine to where hesitancy isn't really an issue yet. It's really about access to the vaccine itself, right? Access to the digital device, to the Wi-Fi, to the language barriers or the challenges that come with the language barriers, and really being able to get from wanting to making an appointment has been challenging for people. So Homeboy really is looking at us determining sort of who gets an appointment, right? Yes, we have to abide by those phases mentioned earlier that the county has outlined, but we're able to sort of get creative a little bit in terms of our targeted outreach to ensure that we are getting the population in on time. So for example, today, if we were to open right now, we probably wouldn't be able to vaccinate all the trainees, but we can vaccinate their parents, their grandparents, their aunts and uncles, just anybody old over the age of 65 who may live with or around them. And that starts to protect their circle of family and people. And then as soon as we're able to, then we open it up to more people in the Homeboy community. I will add that there's also the common sense part of it. And the mayor has specifically said that we won't waste any vaccine. So if it says 65 and over, and we do that, and at the end of the day, we have X number of vaccines that are just there available that we have to use, we will use those on whoever is around, whoever we feel is priority, even if they're not within the phase eligibility yet. If they're under 65 and they're there and we have 10 extra shots to give, we're gonna give those 10 extra shots. We're not gonna waste them or throw them away. So there is over time the possibility that more of our trainee staff and our family get the vaccine.
Good idea.
There was a question about anything that could be done kind of pre-vaccine to get ready to get the vaccine. I can only say, I don't know. No.
Nothing.
Just get a good night's sleep and eat a good breakfast. I really can't, I can't think of anything.
Yeah, everything I've read is leads to sleep. Leads to sleep.
You know,
go ahead.
Well, one thing that I did read about, very interesting study out of Hong Kong, talking about your intestinal biome, and what that means is basically what's in your colon, what's going into your body and what's coming out of your body. And as usual, the evidence points to good diet, fresh fruits and vegetables, less processed sugars, less fats, to maintain a healthy biome, which then protects somewhat, they think, against getting severe COVID. So once again, eat good food, eat your fruits and vegetables.
Yeah, so
really,
one of the things I've been doing lately is doing these like little ginger shots, lemon ginger. So lemon, ginger, turmeric blended in there, and have like a little shot every morning, just immune boosters. But anything that any fruits or vegetables that boost your immune system, definitely lemon, oranges, that helps. In terms of the sleep stuff, so there was a study, or there is a study that focuses on melatonin, which is the stuff that helps you sleep. You know, a lot of people use it when they're on the plane, and that helps them rest. And they say that helps with the reduction of the symptoms of COVID when you get sick. So but it's not the melatonin itself. There's nothing in the melatonin that's medicinal. It's the fact that melatonin helps you stay in the REM sleep a little bit longer in that, you have your sleep cycles. So being in the REM sleep is what changes something in your immune system to be able to then defend itself a little bit better. So, there's a lot of things out there, but overall it's just be as healthy as possible, especially leading up to your first vaccination, your second vaccination, and being rested.
And also plan, this is something that you can prep for, which is to kind of clear your schedule just in case and expect to kind of feel sick on the day after. Yeah, so I think that's one of the best things we can do is just clear our schedule or be ready for it.
So Isaac's question here about coming in to be vaccinated when you have symptoms. I actually saw somebody at Kaiser asking that question who had symptoms a couple of weeks ago. So doctor, can you address that?
That's an interesting question. I think obviously the best thing would be to get tested first. And if you are positive, then wait to get the vaccine. Because I think, as we discussed earlier, we're thinking that if you are infected, that you have immunity for about 3 months, right? So if you're sick, you're already getting antibody. You're already going to be manufacturing the antibody. So I would say step one would be to get tested, and then if you are sick, wait. I am just speaking off the top of my head, though, Maria Elena. I don't know the definitive answer.
Yeah, so I've heard the same in other workshops that we've been a part of. Where it gets maybe a little bit trickier is your second dose, where people feel like it's my 20th day and I have to go get it, otherwise it's not effective. So you can still wait, right? It's still almost as effective even up to 6 weeks out. So again, Pfizer's 21 days, the Moderna's 28 days, but you can still go 6 weeks later. So that gives you enough time, even if it's on your 28th day that you get sick, you can still quarantine for the 14 days and still make it within the 6 weeks to get your second shot. So there's not, again, from what I've heard, there's not a lot of research on saying it's a good or bad idea to do it while you're sick, but there's a whole lot of research that says you shouldn't be going anywhere when you're sick. So don't go out when you're sick and get other people sick, right? That's the opposite of what you want to do, especially in a line where people are on their way to getting the vaccine. So definitely still use the 14-day rule to quarantine.
Maru's laughing at something. We want to hear the joke. Oh, you were laughing. Oh, have to unmute.
I'm sorry, I was laughing with one of my sons. Sorry. Thank you.
So we got 7 more minutes. Any other questions, concerns, comments? No, everybody's good? Who, raise their hands, who has gotten their first shot? Just curious.
Not us.
Who has gotten their second shot?
Ooh.
Quite a few people, yeah. Isaac, we're gonna bring it to Homeboy, man. We're gonna get as many people vaccinated as possible.
You gotta catch me first. Nah, I'm just kidding.
Maybe we should make buttons.
Listen, I think that would be that's a great idea.
Okay,
and
let's start designing some buttons. You got all that artwork from.
Yeah, so I, earlier, I forget if it was Dr. Pierre or Naya who said that they wear their pins. So I looked up t-shirts. So maybe our silkscreen could do some Homeboy t-shirts with on the back, vaccinated, the little check
Yeah.
marks. So,
But when you could, all the drive-in and walk-in people could be given a button or a sticker,
yep,
like the voting,
Yep.
I voted sticker.
yeah.
Those are cheap to make.
I do want to say that having had now the second vaccination, it is not changing one thing in my daily life. I'm still masking up. I'm only wearing one mask, but it's not changing my social distancing, my hand washing, my mask wearing. But I have to tell you, I feel like I can breathe a huge sigh of relief that I might get COVID, but I'm not going to die. I am not going to be one of those patients who Dr. Anaya described as gasping for air, not having any kind of resources to get better. And it's a huge relief. It's a huge relief. And I want everybody to feel that. So go get your vaccinations.
We're still in line, some of us.
Just really quickly, Doctor, can you kind of confirm, which is, a lot of people had questions about, how it affects the baby or someone being pregnant. So as far as we know, it doesn't, right? It's very unstable. It goes into our system, does the job, and then leaves, right?
Right.
Okay.
There should be no side effects for the mother or the baby, and or the fetus or a baby that's being breastfed. So all around, it's a good idea to get the vaccination.
I want to be able to let Isaac ask this question, but this is a really a great point, which is, people always throw out, "Are you allergic?" That's a really, really general term, allergy. So we know that this vaccine is not made from eggs, right, or peanut, or the more common allergies, right? Plastic,
Right.
latex, all of those stuff, right?
So I've been doing a little reading about the allergy and about allergic reactions. First of all, no one has died from an allergic reaction to this medication. No one has required, I can't say that. What I do know is that even if you have had a severe reaction to a vaccine, that you can still get the vaccination. Like you said, Van, the production of the vaccine is so simple. It doesn't contain eggs. It doesn't contain, the only thing that it contains is the polyethylene glycol, PEG, which is used to preserve it's used to coat the mRNA. And that may be something that people are allergic to, but there is the allergic reactions have been very minor and almost non-existent. I wrote something down this morning, I don't know if I can find it, about the incidence of allergic reactions. And it's like literally one in a million. So it is very, very rare. And I can get the data. I didn't bring it upstairs with me, but it's pretty impressive how minimal they are and how minor they are. So, I mean, there aren't a lot of them and they aren't serious. So, anaphylaxis is like the worst allergic reaction you can get. It's when basically your whole system just collapses. Your heart can't work, your vessels, it's terrible. 0 cases of that. No cases of that. The kind of allergic reactions that people have gotten are some swelling, maybe hives, swelling in the throat, but nothing that hasn't been able to be treated very quickly with something that made it better. So I don't think that and there are no hard exclusions for people who cannot get the vaccine. In other words, there is nobody who cannot get the vaccine, even if you've had severe allergic reactions.
I didn't know that. Thank you so much. Just a couple minutes or a minute or two. Can you answer Isaac's question, which I think is really important? What about for people with underlying conditions like hepatitis, things like that, that's really prevalent in the population?
Like I said, there are no what we call contraindications for getting the vaccination. If you have underlying disease of any kind or any kind of underlying conditions, any history of anything, there is no reason not to get the vaccine. It's so safe and it's so effective. I want that message to get out. That's a huge, huge message. It's safe and it's effective. And it's going to change our lives. It's going to get us back to normal. I want to get back to normal.
The new normal.
All right, we're at the 11:31 mark. Any last questions, comments, thoughts? All right. Thank you, Dr. Lee. Thank you, everybody.
All right.
Thank you, everyone.
You all be safe.
Thank you.
Let's
Guys
design
have a
some
blessed day.
buttons.
Yes,
Yes.
Buttons, yes.
for sure.
Thanks, everyone.
Cool. All right.
See y'all.
Thank you.